I had just had my second child, and I noticed that there was kind of an abnormal area in my left breast, and the imaging workup showed that there was about a 7 or 8 centimeter mass there. I still wasn't that worried. This is what I do for a living. I diagnose breast cancer. This probably isn't going to be my story. They did a biopsy of the mass, and the next day I was back at work, waiting for my colleague to come knock on my door and tell me the results of my biopsy. Eventually, she did come to my door. She had a colleague with her, and I knew the second that I saw the two of them together that the colleague was there to help her deliver bad news to me. It was me this time that was getting a cancer diagnosis. I learned firsthand really what that felt like.
A major part of what we do as physicians involves understanding what's important to a patient, understanding how a diagnosis or treatment plan is going to affect that person's life, and being able to communicate why we think that a certain clinical decision might be the right one for a patient. And for all of those things, empathy is critically important.
We do have research to tell us that empathy is important. We know that having a trusting relationship, if the patient is perceiving that trust, that then translates into gains in patient satisfaction, provider satisfaction. It's associated with better quality outcomes.
Listening is at the heart and core of empathy, and then derivative from that is being able to place the patient's experience in a broader context to more fully understand the implications of the disease, of the patient's life, on their well-being and the well-being of those around them.
Being a patient opened my eyes to a lot of what patients go through, but I don't think that it's the only way you can gain understanding about what it's like to be in someone else's shoes. I think there is some empathy built into the character of young physicians as they enter a field that really is a lot about empathy, but it's unfortunate sometimes the system isn't built to capture that and nurture that in a positive way.
Technology is now interwoven into almost everything that we do in clinical care, and I think that can at times detract from human connection and the interactions that many of us went into medicine for.
There has been, over these past decades, a rapid expansion of biomedical knowledge, but in some cases, that knowledge and the way it's been applied and the technology accompanying it have served to distance care providers from their patients.
Just as much as we're teaching the biomedical sciences, basic sciences during the preclinical years and the clinical years for the medical students, we need to equally be thinking about how to build their listening skills and their ability to connect to patients, their ability to build that empathy with their patients.
Medical students, learn how to examine the patient in their first 2 years of medical school. And then they arrive on the wards and they find, to their dismay, I think, that the currency on the wards doesn't revolve around the patient as much as it does around the computer, which led us to particularly embrace something we're calling presence. Its full name is Presence, the Art and Science of Human Connection. And it really is about trying to foster interdisciplinary work in order to enhance the experience of being human.
I have been really appreciating what Presence has been doing for us. A lot has come out of Presence. One in particular is the Presence 5 initiative.
The Presence 5 study is an initiative that's bringing together researchers from the different disciplines across Stanford and the School of Medicine. And our goal is to identify specific, discrete actions that clinicians can take to be more fully engaged in the moment with patients.
Making a young physician present is really a matter of undoing a lot of the things that the old physicians have left them as a legacy. But I think we now have a new mandate to embrace that. Not only is the patient at the center, but the human being is also in the center.
My own personal journey opened my eyes to a lot of what patients go through. And I think a lot of the benefit I brought back to my practice was sharing this story with other physicians or other physicians in training, other patients. Medicine is not a factory. It's art and a science.
It's two human beings coming together ultimately. And one human being is in a state where they require more than the science. They require compassion, they require understanding. There's a subtext in there dealing with us, which is, please help me.